our patients don't really care what's underneath. Is it an implant? Is it a natural tooth? They'd like to see ideal aesthetics, and soft tissue aesthetics is really one of the most important things when it comes to aesthetic dentistry. And we're talking about good tissue quality and quantity and having ideal interproximal tissue, and of course, soft tissue health. And very often, our patients presenting to us with tissue deficiency. It could be in the form of recession or black triangles or missing papilla or soft tissue problems and other things. And really the question is, what are the options that we have to address these problems on teeth and implants? And for each option, what is the success rate? It's probably the most common question that I'm getting during my courses and online, and when I meet with doctors and mentor them. Doctors ask me, so what's the best option? What's the best technique? Give me something simple that I can apply immediately. And the answer is not as simple because every case is so different. For example, if you're dealing with tissue quantity or recession, you probably have about 20 to 30 different types of techniques and different variations on the theme that can address this problem. And when you deal with tissue quality problems, we probably have less options, but we have different ways to address the mucogingival problems, the minimally attached and keratinized tissue. And a lot of doctors, maybe you as well, are very confused about what can we do, what are the options. And of course, it becomes much more challenging when patients are presenting with more than one tooth that has a soft tissue problem or a full arch or a full mouth. And we're starting to develop and see great success in procedures that treat multiple recession sites. And one of the examples is using a tunneling with an allograft approach, or an alloderm in this case, where we are treating multiple recession sites with an allograft material with a tunneling technique that can be learned and applied. And we can get pretty good success. I think you'll agree with me that this, in this case, we have achieved very good aesthetics, root coverage long term. The real question is, before we start talking about technique and how to do things, is does it always work? Meaning, is it predictable? If I'm going to treat the same case or the same deficiency with the same technique 10 times, one after the other, exact same technique, same operator, same instruments, same materials, am I going to get the same result? And the answer is most definitely no, because we have so much patient variability. We have different circumstances that caused the problem. And if these are not under control, we're not always going to get the same result. So this is where it becomes a little bit more challenging. Same goes for treating mucogingival problems like minimally attached tissue. We have not enough keratinization. If you're going to treat this case with a free gingival graft or the epithelialized palatal graft, which is a technique that's been around since 1962, you can get pretty good results. You can increase the zone of attached tissue. You can even cover some of the recession, all of the recession in this case. You can get a very pleasing result in terms of the goals that we set for this case. But is it always going to work the same way? That's such a great question. I can say with the free gingival graft, I'm getting very high predictability. I can say that probably 90%, I'm getting very similar results. So for me, that's the most predictable. But it's not for every case. And now we have so many different soft tissue techniques to address recession and mucogingival problems and other problems around teeth and around implants, that it gets a little bit confusing. It almost becomes like a religion. You got to believe in it for it to work. And there are different schools of thoughts and actually a lot of dogma out there that says that people with dogma, meaning that say, this is the only way we can treat this particular problem. And I have a little bit of a different opinion, because if you look at some of the science or research, the little that there is comparing all these procedures, and this is something from 2003 that showed that the connective tissue graft has the highest success in terms of root coverage. And even recently, 2015, still the connective tissue graft has the highest success and the highest predictability, not 100%. And this is what the science shows, but the problem is that we actually have no research that compares everything that we have out there. So in reality, what we need to figure out is what are the keys to success. Don't jump and learn a procedure and start applying it for every case. Don't get hung up on the procedure. Start to understand, first of all, the etiology for recession or the multiple etiologies. Start to understand why these things are happening. And understand when soft tissue grafts are going to be successful. That's actually much more important than learning a particular technique. Because if you don't know the keys to success and you're just following a recipe that worked for me or worked for Dan or other experts, you'll get different results. You may even have failures because you didn't look into the specifics of what will make this case successful. So